Good afternoon. Welcome to the Center for Disaster Philanthropy webinar, COVID-19 Checkup, Assessing Response and Planning Recovery. I'm Regine Webster, Vice President of CDP. Just 18 months ago, I know it feels way longer, the world learned of a new coronavirus that had been discovered in Wuhan, China. And only 6 months ago, the first medical staff and at-risk individuals started getting their vaccines. In our webinar today, we're going to gauge our success as a nation and across the world in light of those days. You know, it's kind of a report card. So this webinar, we're so thankful, is co-sponsored by the Council on Foundations, the Funders Network, Grantmakers in Aging, the National Center for Family Philanthropy, and the United Philanthropy Forum. A few reminders, you've heard them all before. This webinar is being recorded. It will be available on our website and on our YouTube channel shortly after our webinar is complete. You can access Zoom created captions today, but we'll have more accurate captions in the recording. At any time that you want to, you are more than welcome to submit questions in our Q&A box, and we'll do our best to answer them at the end of our panel presentation. And if you're on Twitter, please use hashtag CDP4Recovery to share and join the discussion. CDP starts all webinars with a land acknowledgement to recognize the original stewards of the land where we live and work. In the spirit of healing, I acknowledge and honor the original people of the land where I am located, now referred to as Nashville, Tennessee. This is among the homelands of the Cherokee, Chickasaw, Shawnee, and Yuchi tribal nations, and has been traversed by many Native peoples who used the Natchez Trace foot trails. Despite centuries-old colonial theft and violence, this is still and always will be Indigenous land. Indigenous people continue to demonstrate their innumerable talents and gifts today amid continued oppression. Turning now to the topic at hand, COVID. I want to run through some of the numbers that we have at our fingertips. I know that our panelists are going to be spending time in their remarks highlighting the impact of COVID-19 and response. What I want to talk about now are just these stats. So as of this morning, June 10th, 175, I can't read this number, you guys. Okay, so I'm gonna let you read the first bullet while I try to figure it out. Meanwhile, 3,780,265 people have died. 158,884,746 have recovered. Within the United States, this is 34,266,374 total cases, just over 613,000 deaths, and almost 28.3 million recoveries. The United States is 4.3 of the world's population, but has 19.5 of the cases and 16.2% of the deaths. And now that I can read the number at the top, I'll say that 175,332,051 people around the world have had COVID. In terms of COVID vaccines, from the first COVID-19 vaccine in December 2020 to June 8, 2021, more than 2.19 billion vaccine doses have been administered in an effort to fight the pandemic. Vaccines are available at a rate of 37.8 million doses daily. Globally, 11.96 of the population have received at least one dose of vaccine. Now, the U.S. vaccination rate is 1.07 million doses a day. This is a 68% decrease from the 3.38 million administered on April 13th. According to the CDC, 171.7 million people, or 51.7% in the U.S., have received at least one dose of a COVID-19 vaccine. And of those, 140.4 million people, or 42.3%, have been fully vaccinated. In the adult population, 18 and over, 53.1% are fully vaccinated. Across the globe, 48% of people who have received at least one vaccination are from North America or Europe, and 52% are from high-income countries. The wealthiest 27 countries have just 10.4% of the world's population, but have 27.3% of the vaccines. In the US, this is 14.3% of vaccines, but only 4.3% of the total population. Countries and regions with the highest incomes are getting vaccinated more than 30 times faster than those with the lowest. CDP released 2 reports on COVID-19 philanthropy in 2020 in conjunction with our colleagues at Candid. In the first 6 months, philanthropy gave $11.9 billion to COVID-19 response, and at the end of 2020, the amount had risen to $20.2 billion. As of June 9th, not so long ago, that total was $24.8 billion. You're going to hear more about this in a few when we hear from one of our speakers, Sally Ray, but CDP launched its COVID-19 response fund at the beginning of March 2020. Since that time, we've received a number of generous gifts, including a $10 million donation from Mackenzie Scott in December. We were beyond honored to be one of her recipients. After 10 rounds of funding, I'm pleased and a little tired to share that as of today, we've been able to make 156 grants to 143 grantees, totaling $27 million in both domestic and international grant making. You're going to get to hear from one of our our grantees as well shortly. So next, I would love to introduce you to the panel members who are joining us today. I'm so excited to be speaking with them, and I'm looking forward to all of the information that they're going to share with us. Sally Ray with the Center for Disaster Philanthropy brings more than 28 years of experience working in the nonprofit world and a passion for community and social service to her current role as Director of Domestic Disaster Recovery Funds. She previously was our Director of Strategic Initiatives and managed both the Texas Winter Storms Fund and the COVID-19 Response Fund. And before that, she was the Director of CDP's Hurricane Harvey Recovery Fund. She is an integral and awesome member of the CDP team. Arisha Hatch is the Vice President and Chief of Campaigns at Color of Change, leading campaigns on civic engagement, voting rights, criminal justice, and corporate and media accountability. Since joining Color of Change in 2012, she's ushered in some groundbreaking victories for Black communities, getting payment processors like MasterCard and PayPal to ban use of their platforms by white supremacists and persuading Saturday Night Live to add 2 Black women to its cast and writers' room mid-season. Okay, that's so cool, Arisha. Dr. Judith Monroe, Judy, is the President and CEO of the CDC Foundation, which she joined in February 2016, following her role as Deputy Director of the U.S. Centers for Disease Control and Prevention and Director of CDC's Office of State, Tribal, Local, and Territorial Support. In her work at the CDC Foundation, Judy advances priority programs that improve the health of people across America and around the world. The CDC Foundation mobilizes philanthropic and private sector resources to support CDC's critical health protection work, managing hundreds of programs here domestically in the United States and more than 140 countries. We also are so pleased to have Judy on another webinar with us. She was actually on as a speaker, a panelist, on our first COVID-19 webinar back on March 5th of 2020. And while we all were in the green room in advance of this call, we all just collectively kind of audibly sighed of how the past 15 months have unfolded since then. So Judy, I am going to start with you. I provided the COVID-19 current data already, but can you give us like more of a top level look at what's happening on a domestic level in terms of COVID-19 response and vaccines?
Yeah, thanks for the question and great to join you today. Really a pleasure. So, right now we are in a time of optimism and hope here in the United States. And a big shout out and thanks to everyone across the country who's been working so hard. And then we really need to, give honor to the amazing effectiveness of the vaccines, as we pointed out. I think a sign of our times, if we think about this, is the low case counts have now really opened up the world in many ways here in the United States. And a sign of that is CDC updating their international travel guidance just this week. And we're having lots of events, and it seems like we're trying to get back to normal, which is terrific. However, if you look on this slide at the level of community transmission, you're still going to see those hotspots. The red means there's high transmission. And of course, the map changes each day, depending on which county. But we're up against still a pretty daunting task to be able to get particularly rural communities vaccinated, minority communities. I mean, there's a lot of work yet to be done, and we're seeing a tapering off of the vaccines that people are, getting in line to receive. So we've dropped below 1 million shots per day, and at our peak, we had even reached 4 million on some days, and we were averaging over 3 million. So this is the National Month of Action with a goal of getting 70% of adults in the United States having at least one vaccine. And there are a lot of incentives. You guys are probably seeing it in the news, all the way from tickets to the Super Bowl and lotteries and free beer and all kinds of things, trying to get folks to do and get their vaccines. We're just an uneven country when you look state to state. So example, like Mississippi, only 34% of adults have been vaccinated there. So we may see spikes in the South. We're not sure. We also, now that the infections have dropped, it's actually children that now account for about 25% of the total COVID-19 cases. And they're considered now, as unvaccinated children, they're becoming a vulnerable host for the coronavirus. We don't know yet if this is going to be a seasonal vaccine. So we're going to see outbreaks this fall and winter. And are we going to need a booster vaccine, or some of the big questions? But I think the main thing right now of great concern are the highly transmissible variants of the coronavirus. And of course, you heard about India, the outbreak there. Britain, that the variant that was in India called the Delta variant is really taking over Britain now. We don't want that to happen here in the United States. So we still need boots on the ground. Right now, the priority is the ground game, person to person, hyper local work to try to get more people vaccinated here to keep us all safe. So that's kind of the
Judy,
big update. Yeah.
Sorry, my bad. When you say 25% are children, are those the 12 to 15 age that are vaccine eligible, or under 12?
These are unvaccinated children in general, all children. And then when we look at the 12 and older, about 50% of those have been vaccinated. And of course, the younger than 12, they're still, the FDA is still working on the authorizing those vaccines.
Okay, that's a helpful clarification. Sally, same question for you. Give us a high level look at what's happening.
Well, I'll give a nod to Judy here because I follow the CDC and all of the reporting and information they share. So, and echo what she said. I think what we're seeing in the US is generally a great improvement of where we were even just a month ago when it comes to vaccine. So I see our biggest current issues is that equitable distribution of vaccine access. Though I think we've come a long way here, there's still some work to be done. Rural communities, low income communities, et cetera. The cold storage issue of some of the vaccines has caused some of that access issues, but mainly it's that misinformation about the vaccines that's a problem. This has been kind of tragic in my mind. I know it's a significant focus for this current administration and of the CDC, but this is still a huge issue. Simply looking at which states, communities, and regions are last in vaccine percentages, you can figure out where this disinformation is most likely spreading. And we've got to find some way to combat that. And I applaud the ways, the incentives that we're giving folks for getting the vaccine, but there has to be a way of tamping down this misinformation. The mental health issues also are created from the trauma of the past year, and then access to services needed to address those issues. We're seeing an increase in violence, particularly domestic violence. And that to me is an indicator that there's a lot of work to be done to address our shared trauma here.
Let me stay with you. Stay with you here. Can you talk about the grants that you've made domestically and how they've changed in the past 15 months?
Yeah, absolutely. We did rapid response grant making in our first 5 rounds from the fund, and that was kind of in an effort to get money out the door really quickly to hopefully mitigate that long-term effect of the pandemic on communities in the US and her territories. These focused significantly on food insecurity, where we funded groups like World Central Kitchen and local and national food pantry providers. Economic insecurity, where we focused on getting direct cash assistance in the hands of those with greatest need by funding Give Directly, Restaurant Workers Community Foundation, and local and regional organizations supporting migrants, immigrants, refugees, others who might not get access to the federal funds. PPE, we kind of got caught up in that a little bit early with the logistical and distribution to providers. Logistical providers like Good 360, and then National Association of Free and Charitable Clinics, who were working to source that and get it to their free clinics. And of course, we did some advocacy to help advocating for marginalized populations. Now, we're trying to do, we're turning toward consideration for recovery from the effects of the past year and a half. We're still considering the economic impact, especially for those communities most disproportionately affected by the pandemic. BIPOC, low income, seniors, disabled, immigrants, and refugees, and the intersectionality of all of these populations. And we support equitable access for distribution of the vaccine. And then we're trying to work to combat the disinformation of the vaccine and the virus, like I spoke to earlier. We're also looking to leverage the spotlight the pandemic has shown on the effects on marginalized populations by supporting advocacy groups, groups like Color of Change, who help provide a unifying voice for the population that they serve. And of course, mental health is a big issue for us and always is. And we need to make sure everyone has access to both mental health and physical health resources.
So Sally, until last week, you were also responsible for international grant making around the pandemic. What advice and information did you give our new colleague, Alex Gray, the Director of International Recovery Funds, about trends in international grant making?
First of all, welcome to Alex. I am so glad you're here. We're trying to make a smooth transition here, but that's still ongoing. But I've suggested to Alex that he read a lot and follow the data provided by several different sources, including our friends at CDC. Where are the virus hotspots and where might they move next? Where are vaccines available? Where are they not? Who's working where and what are they doing? I've also suggested he connect with fellow funders. What are they funding? Are there gaps that they might not be able to fund that can be covered instead, that we can cover instead? And we have some amazing existing grantee partners and others that could potentially be grantee partners. He's beginning to meet with them to see what they're experiencing, where the greatest needs might be, how we might be helpful in filling their gaps, their funding gaps. Basically, I suggested he look at the geography, the population in each location, and the issues each population in each geography might be facing. It's no small task, which is why I'm really glad he's here.
You know, Sally, how much I love the framing of geography, population, and issues. It's such a sound organizing principle. It doesn't mean it's easy, but it's sound. Judy, back over to you. What are you seeing at the international level in terms of response?
Yeah, so I think when we look at the world at large, obviously the vaccines matter on this, and we really have a two-track pandemic, as the World Health Organization has really warned us, where our rich countries have the high rates of vaccinated people, and yet, and they're, we're looking at ending restrictions in the U.S. and other countries, and then in other countries, they're facing really extremely dangerous situations with deaths that are rising in Africa, as an example, the Americas, Western Pacific in the last week. And so there is a call for an international response, and we'll continue to see these hotspots vary. Just in like South Africa, they saw a 25% increase in new cases just this past week. And so it's rather daunting. The big call, of course, is the response needs to be about vaccines. I was really pleased to see the U.S. Pledge 500 million doses of the Pfizer vaccine, and I think that's going to rally other countries to step forward. One of the things with the response that we've got to remember is it's not just the folks being that are sick from the virus, the SARS-CoV-2, but this has had a huge impact globally on poverty. We have 689 million people living in extreme poverty, which is defined as living on $1.90 a day. Half of them are children, but the coronavirus pandemic has demolished 2 decades of progress, pushing an additional 120 million people into extreme poverty. And that's expected to continue to rise. When we look at the response of the needs across the world besides vaccines, there's a major need for public health and medical care support. And of course, the international community is rising and helping. CDC's involved in many countries to try to help with those types of needs. We heard, India, of course, had a major outbreak recently, the need for oxygen and medical supplies. But then we can't forget just the humanitarian needs. Children across the world have lost parents. The number of orphans that this pandemic has created is just heartbreaking. So there's much to be done.
Judy, the delta in global poverty rates and what you talked about, the erasure of 2 decades of progress is really, really sobering. I'm I'll say that. That's all it's just really staggering. Arisha, I want to bring you into, go ahead. Sorry, Judy.
No, that's what I was just agreeing. And then, the variants, I didn't mention that, but the tracking there are numerous variants now that the World Health Organization is tracking. And some of those, of course, are more transmissible than others. And so this story is still unfolding before our eyes.
For sure. Aretha, let's bring you into the conversation too. So Color of Change was one of CDP's early grantees, and one of the first grants we made that reflected how different COVID-19 grant making was from our, typical, in quotation marks, disaster recovery grants. Can you tell us about the work you were doing at the beginning in terms of building local power?
Sure. And I want to just thank CDP for their early support at a time organizationally and in the world where things were totally in a state of flux and chaos. This COVID hit very close to home for me. I actually lost my father at the beginning of the pandemic in March 9th. And I'm just super impressed by the members of my team that kept moving forward, who kept organizing. There was so much amazing rapid response work. And in reflection, it shouldn't have had to be such rapid response work, but rapid response work early on, both at the national level and the local level. For us as an organization that's really focused on helping to improve the lives of Black people in the United States, we immediately saw and went into action over a set of disinformation that was running rampant throughout media. Immediately, there were memes about how Black people were immune from COVID. We spent a lot of time with social media companies making sure that they remove those things or place warnings. Immediately, there were books on Amazon bookstore with disinformation about COVID. And so we went into immediate overdrive on that level. And then we also saw our members at the local level move into rapid response mode. We saw folks in Florida who were concerned about their kids who didn't have enough internet to participate in their classes, petitioning their local city councils for more support there. We had a squad leader who really cared about healthy food options, who worked with her team to push for the Crenshaw market, the healthy food market in a food desert in Crenshaw to stay open. Many others in California and white neighborhoods were kept open. But of course they shut down the Crenshaw market. And so we saw our members really participating and stepping up to lead. We had folks passing out PPE and wanting to deliver food to folks who need it. So I just really experienced this as a moment where folks really went all hands on deck to try to win things despite the extreme obstacles that they were facing.
Arisha, I am so thankful for the work that you have done and the way that you just articulated that so beautifully for us. But I don't want this moment to go by without saying how personally sorry I am for your father's passing. I'm so sorry for your loss.
Thank you. Thank you.
In our planning session, you said something interesting that I want to follow up on. You said, quote, "The world is pressing toward reopening, but for many Black people, it never shut down." What does that mean? Can you tell us more about that?
Yeah, I just think about as I experienced this pandemic, I experienced two different families, even within my own family. When my father passed early on, I was able to move online to work. My brother, who works for a tech company, and his wife, who was a college professor, my mom, who was retired and who could afford to be retired, we sort of hunkered down. My colleagues that I work with sort of hunkered down. And yet I have family that were nurses. I have family that took on extra jobs, delivery jobs, because they couldn't afford to sequester. And then frankly, I have family that never, even if they could, they wouldn't have. We saw this in a real way, these sort of different dichotomies in different communities as the uprisings of last summer started. For a while, our members were really anxious when we asked them to shut down events and no longer do brunches. And for them, the breaking point was really started in the summer after the murder of George Floyd. We had members telling us, our squad leaders telling us, we're doing an event with or without you. And that was a challenge to our organization, which was really focused on wanting to keep folks as safe as possible. And so as I think about, I know there's a very important conversation about reopening, and I'm very much like living through that conversation in my own personal life. There are so many people who are close to me who became essential workers before they knew that they were essential workers, and who actively fought, in some cases, to push for reopening much sooner, or who refused to sort of go. And so I'm constantly thinking about those set of folks as we continue to organize.
So the next question I love, because it's brass tacks, right? We know, and we knew relatively early on, that disparities exist around both the impact of COVID-19 on communities, but especially around vaccine access. So tell us about the guides you've made to help address these disparities.
Yeah, we spent a lot of time understanding that misinformation and disinformation are going to happen. And once that sort of genie's out of the bottle, it's hard to put it back in. And the way through that is by having trusted messengers deliver messages. And so we spent a lot of time, a lot of work creating content that we could pass to our members, that they could pass to their friends. We launched really early a website called the Black COVID Response that was, again, trying to push back against this narrative that was emerging that Black people were immune, to sort of say, like, no, this is a racial justice issue that hits us in so many different ways. We put out 2 Black patients guides with Dr. Ruth, who is pictured here, who is an Atlanta-based doctor, and who was getting a lot of questions from her parents. How would taking the vaccine affect fertility, sort of questions, basic questions about mutations and the effectiveness of vaccines. And so we invested a lot of time and energy into actually having deep conversations, first about the pandemic and what it looked like to be safe, and then of course about the vaccine and the importance of that sort of work. But we really saw our role as making sure that people knew that Black folks weren't immune, that they would be disproportionately impacted, and that we had a lot of work to do together to push back against those narratives.
That's just amazing. Again, I love how practical and tactical this is. It's so amazing. Sally, I'm coming back over to you. What are the lessons that you think that philanthropy has learned, or perhaps that you hope that they've started learning through the past 18 months of the pandemic?
I hope we're finally all learning what we at CDP have been preaching since our creation, There are root causes of systemic issues that are simply exacerbated in a disaster, including this pandemic. That's one reason why I know we say every funder is a disaster funder. If you're funding in housing, healthcare, education, whatever you're funding in, those are the issues that are first and foremost affected by a disaster. Access to affordable housing is a systemic issue. Even the US healthcare infrastructure struggles with providing care, accessing needed PPE. They struggled with that, accessing needed PPE and other safety and protection, access to needed medicines and affordable access to medicines that treat chronic disease that we know are comorbidities for this virus. Systemically marginalized populations are those who are most disproportionately affected by any disaster, but we saw that laid bare here. Children, childcare access, education, the digital divide, our social and humanitarian relief, the safety net is woefully inadequate, and that was laid bare here. And of course, food insecurity and our food chain has weak links that we must fix, and we must find some way to fix. So those are systemic root causes of and societal issues that are impacted and exacerbated by any disaster. So I hope that we've also begun to consider that we need to fund the full arc of any disaster. So this is a pandemic. It's a different kind of disaster than a hurricane or an earthquake or a wildfire, but it's still a disaster, and the same sort of thing happens. In other words, we need to fund and make sure immediate relief is covered and it's needed, but we also have to fund recovery, especially long-term recovery. That's why we still have money left in our COVID fund. Preparedness, mitigation, in order to better prepare ourselves for the ever increasing traumatic impact on our global communities by disaster. We have to look at the full disaster cycle and not just the immediate relief and immediate response.
Thanks for that. That's a really thoughtful answer, Sally. Judy, where do you think that philanthropy can be most effective right now, both here domestically as well as globally?
Well, I will say that was a really good answer. So I would agree with everything that was just said. And thank you to philanthropy, because philanthropy can be such a lifeline as well as catalytic. We're in a marathon here, and every dollar counts. And so what I would say to philanthropy here in the United States, for starters, community-based organizations, they are really playing a key role right now with the equitable distribution of vaccines, but they also are helping with all of those social determinants of health, those root causes that you just saw on the slide. There's such a need for supporting community-based organizations. We at CDC Foundation, we're funding about 147 CBOs right now around the nation to help both with the vaccine distribution as well as helping people get back on their feet in the aftermath of this pandemic. The other thing I would say, there's going to be a lot of chronic disease. So this is not just a marathon in terms of overcoming the pandemic, but we're talking about the long haulers that you're hearing about. We still are learning how many people are going to be left with chronic conditions following the pandemic, and there's going to be a need for philanthropy, both in research and for support for individuals. And then the second thing in the United States is the public health infrastructure. Public health has lost jobs over the last decade or so. And when public health is not strong, we're all vulnerable. So there's opportunities in your local communities to support what I believe is really the fabric that we need to build is the relationship between our CBOs and our local health departments, in addition to the businesses and others in the ecosystem. And then on the global front, global health security, there's a global health security agenda. A lot of entities are standing up now to try to prevent the next pandemic. And of course, the immediate need right now are the vaccines. So you can't go wrong by helping get vaccines across the world.
Yeah, makes perfect sense. So I'm going to move now to audience Q&A. And so we have two that have come in so far, but I I'm going to take moderator license and ask two questions more. One, and I know all three of you know this is coming, by the way, but here we go. What's keeping you all up at night in terms of COVID-19 response and recovery? And you guys can go in any order you want to and pass the baton as you wish.
Well, I can start. You know me, never afraid to jump in and offer my opinion. What's keeping me up at night is helping people understand the scientific need for equitable access to the vaccine and making sure everyone understands the importance of getting it. I live in Texas, which has one of the lowest vaccination rates in the US, but has fully opened up and no longer has any viable restrictions. I worry about where the next surge might be or what the next variant might do and how many more people have to die before we fully understand the need for and the importance of global vaccine access. That having vaccine access in India is just as important as having it in Texas. So, you know, because we're a global community, right? And that keeps me up at night. So I'll pass to Arisha.
I think, you know, what keeps me up at night are the same things that have kept me up for the last year. Just that for Black people, this is like the perfect storm of that combines like our distrust in doctors with our distrust in government, with our distrust in media, and how that sort of affects real world outcomes. I think about the dreams deferred, the businesses that folks were trying to start and pour their hearts and lives into that will never work out. And, you know, the fact that sometimes we're better at recognizing, like in some ways we were more responsive to this disaster than we have been responsive to the disasters that Black communities and other POC communities have been facing for so long. You know, I just think this pandemic exposed a lot of gaps that we could fix in a more universal way, but that sense of urgency will sort of move.
Yeah, so this is Judy.
Judy,
Sure, I'll jump in. So I have to say, since the beginning of the pandemic and continue, I am awake at night worrying about the pushback on public health authority and the loss of trust that you know, has been sporadic and sometimes pretty intense with public health and authority, which comes to the science side of it. We can't discount how powerful these vaccines are, and yet folks don't trust that and are resistant to receiving those. So that keeps me up at night. The other is the chronic disease I mentioned, the orphans, all of this is going to increase burden on our systems, which then drives home even more the need for equity, because it will be the most disadvantaged that are going to have the greatest trauma from all of this, and that really keeps me up at night. So we all need to collectively join forces and approach these issues systematically.
Yeah, it's definitely a collective effort. Another question for the three of you. What does full recovery look like for our families and our communities? Sally, will you kick us off?
Oh, I was afraid you're going to call on me that time. Full recovery. I mean, I don't know. Have we ever gotten to full recovery? I guess it means that we've been vaccinated. The disease is at bay as much as possible, that we fully understand the impact on all of the communities, and we've begun to address those root causes and looked at access to affordable housing and access to improving food chain, work on our humanitarian systems so that we can mitigate that loss, that loss on of the increase in poverty. I mean, there's so much that has to be addressed. You know, I guess, do we ever really ultimately reach full recovery? I think it's just a trajectory toward a better world, toward people understanding the intersection of all of these things going on at one time, and how we can improve the basic systems and infrastructure that are in place to make sure that we're better prepared for the next one.
I agree with all. I'll just jump in. I agree with all of that. Full recovery for Black families means that, once their kids are able to get on the bus and go back to school, that they're not introduced into a system of incarceration, or that as we move back out into the streets, that we aren't over-policed in ways that we can, that there's an intentional investment in sort of the healing that needs to happen across communities, not only from this pandemic, but from the many pandemics that we faced. Those are some of the things that I think about.
And this is Judy. I'll jump in to add to what others have said. We haven't talked a lot about mental health. It's been mentioned, but it's going to take us a while. I mean, this has led to substance use. There are so many stressors from the pandemic. So it's going to be a long time to get to full recovery to address the mental health issues. In terms of our children getting back to school, we won't really reach full recovery until those children have recovered the loss of learning that's taken place during the pandemic, and how long that might take. And then in terms of our economy and just folks' livelihoods, until everyone is able to get back to the work that they wish to do and get their careers back on track that have been disrupted. I think we've got a long ways for full recovery.
Judy, since you just mentioned the topic of mental health, I'm going to ask you this question that's come to us from Christopher Chill. How much interest is there in supporting post-COVID recovery and resiliency resiliency building among older adults and older adult services in the U.S.? I noticed that you mentioned mental health services, for instance, as well as COVID vaccination efforts among low-income and minority communities. What about training and technical assistance for senior centers to enhance the services to older adults in the post-COVID era?
Yeah, I think there is interest. And one of the things on a high note, and I think an opportunity that we have before us, is with the American Recovery Act, there's a lot of funding going to a lot of, I know primarily what's coming out from CDC, but there are others, and SAMHSA actually just released, I don't know how many billions of dollars for mental health. And I know there's funding going to so many different entities that I'm quite certain that in answer to that question, that there will be major opportunities to be able to address those issues for older Americans. The key to me, and another thing that keeps me up at night, is with all the funding coming out quickly as a country and as our state governments primarily are involved, and local governments, are we going to use these dollars most effectively and strategically, and not silo the funding, because I think we're going to be much more effective. But it's a lot harder work when you have to bring everyone around the table and make sure that you've got a good strategic plan and you're addressing the highest priority issues. But I think we have huge opportunity in the moment that we're in right now.
That makes a ton of sense. Sally, question for you from Dale Anglin. I hope I'm saying that correctly. When do you see foundations stopping COVID recovery work? I manage a funding collaborative, and some foundations are questioning when they can go back to quote unquote regular grant making.
This feeds my comment earlier. Probably addresses this. Every funder is a disaster funder. And I'll use an example. We internally we manage multiple funds, and we've done an awful lot of collaborative work among those funds, where we've added some COVID response and recovery dollars to, for instance, a grant that's being made in the Midwest to support their recovery from a low attention disaster. Because we know that right now, COVID is a big player. It's having an impact and an effect on everything that we do. So I think for a very long time, we're going to have to be talking about the COVID element in any grant we make. There's a COVID, we just made some grants to support hurricane recovery in Louisiana and other areas from last year. And we added COVID dollars to that. We're adding COVID dollars to our wildfire recovery grants that we're making, because we recognize that COVID is affecting everything that everyone is trying to do to support recovery from anything, to support enhancement of anything. COVID is a factor. So I can't tell you that. I mean, it's going to have to be a personal decision by that foundation. But again, you have to consider the full impact of what this has had on our world when we're making grants for any particular issue.
Judy, can you speak to this question here from an anonymous attendee about vaccine rates in South and Central America? Do you have those figures handy?
I don't have them actually right in front of me, but they're certainly lagging. I mean, that's a part of the world that is way behind on vaccines, and we just need to get more vaccines to them. I can probably look it up real quick.
And I'm not sure. There you go. I'm not totally sure which one of you will want to take this, so I'll just read the question out loud and then one of you can dive in. But is there a cross-fertilization of domestic and global learning on how best to address vulnerable communities?
Ooh, I don't know.
None of you are jumping.
I don't know. I'm not exactly sure. I think there is certainly some common actors who work in the humanitarian space that are having these conversations, and they work in multiple countries and even domestically. So I think the humanitarian sector is having these conversations. I can't speak specifically to that. Regine, you know my limitations there, but I do believe that there is a universal conversation about how we can address that. But you also have to understand that when we talk geography population issue, that it's different in every geography with every population and with every issue. So you can have some standards or some conversations about how best to do something someplace that might replicate in another place, but I don't know that it's always going to be exactly the same from country to country and region to region.
We had a question that came in, and I just want to double down on it, Arisha, just to make sure that we fully covered the question. So apologies if there's some part in here that's a bit repetitive, but I think that this is really helpful, a helpful learning question for all of us. So what's changed in regard to applying an equity lens to your philanthropic efforts, and what else do you think needs to change? And talk to us about the systemic issues you're seeking to address or eradicate, and in what ways. And again, Arisha, I know there's a touch of this that you've covered, but this is a question that came into us in advance of the webinar, and I just think it's important to really underscore the opportunities there. And I bet then that Sally will have some ideas to add as well.
Yeah, well, in terms of our work, there are, I think, a number of systemic issues that we're seeking to address and eradicate as a multi-issue organization. We're really focused on the systems that create a more, a less humane and more hostile world for Black people. And so, you know, we live in a racial justice lens as an organization like Color of Change, and are laser focused on making sure that we can help Black people when real world change. You know, I think some of the systemic issues that obviously continue to be elevated throughout this pandemic are connected to economic justice issues. You know, if we looked at, you know, just where people were, what people had to survive as they needed to hunker down, there are obviously clear disparities in terms of that. As we looked closer at, you know, the way assistance was provided to businesses across the country, and saw very clearly how small Black businesses were sort of written out of that algorithm or formula that would allow them to get assistance. You know, those are, you know, systems that existed prior that were exacerbated through the pandemic. And so those are a few examples of the places that we're trying to intervene as an organization.
Yeah, those are solid answers. Anything to add on your part, Sally?
Well, I think we've always done our grant making with an equity lens, but I also believe that COVID has really laid that open for us and what that means for us. We've often thought about doing advocacy work, and we've dabbled in it before, or funding advocacy work. But with the social and racial justice and all the unrest that we had last summer with the death of George Floyd and Breonna Taylor, particularly in the US, we realized that it was imperative, particularly in the time of a pandemic, to fund those unifying voices and the advocacy for those people. You know, we had an election happening too. So part of what we helped fund was making sure that voter registration was up and people understood how to vote so that we could make sure that in a pandemic, we still had good voter turnout. So we began to understand how these systemic root causes, and we always understood that, but we're sharing that and really diving deep into making sure we're addressing those root causes with our grant making and understanding how a disaster or, in this case, a pandemic affects and exacerbates the problems that are already existing. So how can we build up those systems and that infrastructure in order to prevent the effects that happen with any disaster?
Judy, I have a question for you about workplace, and I think Arisha, you may have something to add into this as well. But this is also a question that came to us before the webinar. How do you navigate employee fears and discomfort about returning to the workplace? And how do we kind of collectively address different needs about working remote versus in place?
That's actually a really terrific question. We've been actually doing a fair amount of work. We have something called the Health Action Alliance at the CDC Foundation, along with other partners like the Robert Wood Johnson Foundation, Business Roundtable, Ad Council, and the Beaumont Foundation are our partners. And on that website, actually, the Health Action Alliance has just a wealth of information on how to address, for businesses, how to address those types of questions. One of the things that, I think leadership obviously is important. And in our own workplace, we've been having all hands meetings to discuss issues, but then we privately allow individuals to work with HR or whoever they're comfortable with, but usually that falls to the HR department to answer individual questions if folks are concerned about coming back into the workplace. As it's interesting, as you've seen, some employers are requiring vaccines, and the law allows employers to ask if individuals have been vaccinated. That obviously has some controversy depending on the business. We at the CDC Foundation are not requiring vaccines. We chose not to do that. We're not asking individuals if they're vaccinated, but we're highly encouraging it and trying to make it easy for folks to be vaccinated. And then we're taking into consideration all their concerns about, whether how clean the space is, how we're distancing offices. And we're planning to do a hybrid model. If folks are really uncomfortable coming back into the office, then we'll work with them to work remotely if that's a major concern. So that's a question. There's a lot to unpack there.
Anything to add on that front?
Yeah, I mean, I think we're like a lot of folks struggling through the issue, trying to take a lot of feedback in and hear where folks are. We sort of announced early on, or relatively early on during the pandemic last year, that we wouldn't consider returning to offices prior to Labor Day in 2022, or that would be like the point where we would begin a rethink. Just before that. And so we're still very much in the thick of that. I think the conversations that we're having across the organization are one about folks' comfort level and individual circumstances. There's a lot of like, where are people right now? Where are they living? And who has been hired? Sort of conversations. And then I think there's conversations happening about what is our theory about offices. And is there what potentially does. We were already sort of existing in a hybrid work model. We were already existing in a world where a lot of folks were traveling, spending a lot of time on the road anyway. But, I think it's open, given us an opportunity to sort of really think about what do we need offices for, what sort of spaces do we need, and what will allow us to be most productive and effective in terms of our mission.
Now that's a helpful context as well. Judy, really quick, where's the list of CBOs funded by the CDC?
Yeah, so we'll be putting those on our website if they're not already up. So I'll check with our staff on that. And if folks want to reach us, we can get that list to you. We actually just created a map across the US to show all the CBOs that we're funding.
That is awesome. We love maps around here. So unfortunately, that's all the time that we have for questions today. But as we begin to wrap up, I just want to summarize some of the discussion and provide the audience with some key takeaways from our conversation. Philanthropists need to embed an equitable disaster recovery framework into their grant making, including a focus on funding Black, Indigenous, and people of color communities. BIPOC communities, as our speakers have shared, are the most impacted group in the United States. We need to rebuild those communities by a direct focus on supporting their needs in recovery. We need to build local networks, local leadership, and local power. Capacity building is so critical, and so is developing that capacity at every local level. Focusing on how close to the ground you can fund, because that's really where we see the most effective action in terms of supporting marginalized communities, but that also really creates long-term impact and sustainability. You heard Sally say it, fund the whole arc of disasters. Look to the future at all costs. In our most recent study of disaster philanthropy, 50% of funding went to response. But it's important that we fund recovery from the pandemic at a local, national, and global level. And this is unlikely to be the last pandemic in our lifetime, so we need to take the lessons and apply them to future planning and preparedness. We need to remember that recovery includes rebuilding families and communities. This virus has torn apart families because of its impact. Recovery isn't just economic, but needs to include the social and community structures of a community. Families need to be supported as they deal with loss, long haulers, and the potential for variants to cause new cases. There is an opportunity for all sectors to seize the moment. I don't think we should go back to the way things were. Just as we may have this new normal in terms of wearing masks and vaccine passports, this is also a time to restructure and refine grant making and philanthropy. Access and a focus on equity should be continued. We need to, like we said, seize this moment to enhance trust-based philanthropy. As our panelists have shared, there will be ongoing needs for assistance with recovery efforts for years to come. CDP has oodles of resources, including several funds devoted to disaster philanthropy that can assist you. Our issue insights provide an introductory look at disasters and responses, and we have recordings of past webinars that you can view. Our disaster profiles provide regular information about the impact of a disaster and the needs of the community to inform philanthropy on how they can help, what they can do. Our staff are always available to provide guidance. You can find more information about our work at disasterphilanthropy.org. To those of you that might be planning disaster response funding, we have many additional resources and information in our Disaster Philanthropy Playbook. It's located at disasterplaybook.org. And we also have another webinar coming down the pike on July 8th at 2 p.m. Eastern. Our next webinar is really going to explore disaster philanthropy and Native Americans, practical tips for funding on and off reservations. In order to respect everyone's time and keep this to an hour, this is all the time that we have for today's webinar. To all those listening to the webinar who've been personally impacted by COVID-19 or seen it affect your friends, families, and colleagues, please know that our thoughts are with you and with them. I'd like to thank our co-sponsors again, Council on Foundations, Grantmakers in Aging, the National Center for Family Philanthropy, the Funders Network, and United Philanthropy Forum. I'd also love to extend a special thanks to Judy, Arisha, and Sally for taking the time to share their insights with us. If you have questions or thoughts that weren't addressed during today's webinar, please email my colleague, Tanya, at tanya.gulliver-garcia@disasterphilanthropy.org. That's all for me today. Thank you all so much and have a wonderful afternoon.